So good morning. I'm Kylie Rodriguez. I am the benefits manager here at the Municipal Health Insurance Consortium. Today we're going to have a few presenters. I'll be the first one, and then Jessica Molesky is our benefits specialist. She'll also be presenting. And we will also have Elin Dowd, our executive director, presenting during this training as well. This training definitely goes over quite a few different topics for all of us. We run a pretty informal training, so if you have questions, feel free to put them in the chat. You're welcome to unmute and ask them. You're never interrupting us. Questions is what makes the presentation more interesting in my mind. And you're also welcome to keep them at the end. We did allot some time at the end to answer questions as well. So today our agenda is pretty full. We're going to cover coordination of benefits, retroactive terminations, 65 plus active employees, how we handle them, COBRA. We also want to provide a quick overview of our wellness program. And Elin's going to touch on our plan management policy that our operations committee has been working hard on, as well as other consortium updates that we have going on. We always like to keep you in the loop. So without further ado, we're going to jump right in. And in case you don't know me, I love polls because it's a way to make sure the audience is still awake and with us. So this is going to be our first poll. I'm just going to pop it up here real quick. There we go. Everyone should see that. So the question is, let's do the lead in here. And Glinda is retiring from the town and does not want to keep her health insurance. The benefit clerk has had her complete the enrollment change form to cancel her coverage. Will the subscriber need to sign the form? And it's a yes or no question. So A is no, B is yes. It's also a little bit of test, see who's had their coffee this morning and ready to click away during our training today. So I'll just give it another 30 seconds to see what the answers are rolling in, and then we'll take a look at those results. Okay, so we have 89% yes and 11% no. So it means most of you have passed the test, right? So without a signature, the cancellation of coverage cannot be processed, right? A signature is required to show that the retiree has decided to not enroll in the coverage. We say this because not only is it important for us, if the retiree calls the consortium and says, oh, I wanted that coverage, I didn't sign off on not getting it. This is the documentation that shows, no, you signed off that you did not want the coverage. It also is supported by you having it on file if they come back and say, no, we never had that conversation about whether I wanted retiree coverage. Yes, I did. Here's the document you signed off on. So best efforts need to be made when a retiree is dropping the health insurance, just to make sure we're documenting all of that conversation to support you and to support us at the consortium. Right. Coordination of benefits. I know I kind of harp on this a little bit every year, but it really is important to make sure we're getting all the information. So this is just another case study. Jim is a new hire and has chosen to enroll in health insurance. Jim has decided he is also going to keep his coverage through his spouse. The benefit clerk who submitted the form to the consortium for enrollment, do they have all the information here? Do they have all the information to properly set up a coordination of benefits? And yes, this is a made-up name, not a real person. And it's not a poll, so just something to look at. See if you can identify if it has everything that it would need. There's missing information, right? So we definitely didn't have all the things that we needed in order to set up the coordination of benefits. Now, even though Jim's the employee, he's enrolling in the health insurance through the employer, and he's keeping his spouse. So his primary insurance is going to be what he's enrolling in through the employer. But his secondary insurance will be the coverage through his spouse. And we need to make sure that that's set up properly so claims get processed correctly, right? So we want to make sure we're paying his primary. We want to make sure that he's still seeing that benefit as the secondary of still having that plan. And sometimes you'll see where they flip-flop them. And then the claims will deny, and then what happens, right? So we get a call saying the insurance isn't working. You get a call saying the insurance isn't working, and it's all because we missed some of that information on that form to properly set up the coordination of benefits. So this is just a highlight of what was missing. We definitely need the name of the carrier. For those of you who do your own data entry, you know that when you go into the Excel system, if you don't have the name of the carrier, you can't enter the information. We also need the ID number because that's what links it over and coordinates that benefit. Just take a pause here. Any questions on how to set up the active employees coordination benefits with their spouse? Okay. So one that's a little bit different is the coordination of benefits of Medicare and for a retiree. So the key point is it's a retiree. It's not an active employee with Medicare. So a retiree would need to always have Medicare A and B because Medicare is their primary insurance. The retiree plan is not their primary insurance once they are Medicare eligible. And that can be at age 65 when they age on to Medicare, or that can be if they're deemed disabled and put on Medicare. So Medicare always becomes primary over the retiree coverage. And then Excelis needs that information, right? So they don't necessarily know what the Medicare ID number is or the effective dates of A and B. So including that information, if you have a retiree who's retiring, going on the retiree plan, and they already have their Medicare set up, putting that information on the form is key to set up that coordination of benefits. And it's located in a different section on the enrollment form. It's actually under section 2 when you're putting in their address and their phone number and their date of birth. This is where you're going to put their Medicare information. Um, The big piece, and I actually just worked with a member this morning, the big piece is making sure that we can show that Medicare is primary, because there's an automatic reduction in the claims when you're on a retiree plan and you're age 65. Meaning, if the bills go to the retiree plan and you're 66 years old, they're only going to pay as much as they would have after Medicare, even if Medicare wasn't billed. So without billing Medicare, the retiree is then going to be getting big bills in the mail because the providers are not billing that Medicare coverage. And I did see something in
There,
the chat.
yes. There's a question. Does this need to be filled out if the employee's spouse goes on Medicare?
And they're retired. So is it an active employee or is it a retiree? If it's a retiree, for sure we'd need that information to set up that coordination of benefits for any retiree that's has Medicare. If they're active, it's still important to have, but if our coverage is their only coverage, we'd be primary over Medicare. So for an active employee, we're considered a large group active employer coverage. So we're primary over Medicare until the subscriber retires.
There's another follow-up. The employee retired and came back part-time.
I've had this question. Jess, I think you've had this question too. So it depends on what you're letting them do with their health insurance. So if they're getting their health insurance as a retiree still and not as an active employee, even though they're part-time, then they would have to follow these rules of making sure that them and their spouse have their Medicare in effect. If they came back part-time and went back on getting active employer coverage, then it shifts how that coordination of benefits is set up. Is there anything else in the chat?
Just came, they said the spouse is retired, not the employee.
Okay, so if the spouse is not retired and is your, let's call them a subscriber because spouse is confusing. If the subscriber is actively employed and covered under our health insurance and then covering their retired spouse, that would still be considered primary coverage. And we do talk about this, I think, in a minute or two. Um, but we would still be primary even though they're retired, so they could opt to not have Part B of Medicare until the subscriber retires. Were there other questions in the chat?
Not yet.
Okay. You just holler at me if there are. So this is just real quick, those that do their own data entry. When these screens come up and they automatically come up auto-filled no, you would mark yes, and then you get a drop-down menu to enter in the Medicare information for any of the family members that might have Medicare, including the subscriber, or the other coverage, you would mark yes if you need to add, the spouse's extra coverage or the kids have extra coverage. This includes setting up coordination of benefits, not only for Medicare, but maybe the kids have Medicaid because they're, on state health insurance. That also is set up through these windows here to enter that information. So these are just examples of what other coverage is. It can be a subscriber and their active work coverage, which we just kind of talked about. It can be the subscriber's spouse or domestic partner is covering them under their work insurance. It can be the subscriber's spouse retiree coverage is also covering your employee or your retiree under their plan. So basically, if they're covered under any other health insurance plan, put it on the form so we can put it into the Excel system so they can update that coordination of benefits. And this is the piece I wanted to just hit on. Social Security doesn't recognize domestic partnerships. So rules when it comes to Medicare are not the same for domestic partners as they are for a spouse. So if your spouse is working past 65 and covering you under their health insurance, you can delay Part B, as long as it's a large group active employer coverage, and avoid any late enrollment penalties with Part B of Medicare. And then you also have a special enrollment period once you retire to then pick up Part B because you were covered under a large group. Domestic partners don't have that same special treatment where, let's say, you're actively working, you're covering your domestic partner who's retired. Your domestic partner would need to pick up Part A and B. Our coverage would still be primary for the subscriber and domestic partner, but you wouldn't be protected, I guess is the best word, from late enrollment penalties for Part B. So I just like to reiterate there is a difference between spouse and domestic partner when it comes to Social Security and that Medicare coordination of benefits, who's primary and all of that stuff, and enrollments and late enrollment penalties. I'm going to take a pause. That was a lot of details right off the get-go. Any questions about coordination of benefits or questions in the chat?
Nothing in the chat.
Okay. All right. I'm going to turn it over to Jess for her portion of the presentation.
All right. So next we are going to go over retroactive terminations, which Kylie, I don't have the ability to move.
Coming.
Thank you.
Had to find my mouse. I'm sorry.
That's okay. So retroactive terminations, we do have another poll question. Ellen retired on June 3rd, 2025, but payroll did not let the benefit clerk know to term her health insurance until October 2025. The consortium paid 4 months of a brand name medication because the member wasn't termed on time. So the question is, what date should Ellen's active coverage have been terminated? June 30th, 2025, the date of retirement, October 31st, 2025, or it depends on the date the termination was submitted to the consortium.
We're still getting some answers to roll in, so I'll just give it a minute or two. Not a minute or two, 30 seconds. You don't need a minute or two. I've kind of stabilized, so I'm going to end the poll, share the
Yes.
results.
Thank you. So it looks like the top answer was June 30th, 2025, which is correct. Coverage should have ended in the month that Ellen last worked. There we go. And the next slide for that, it's important to process whether you're a large group or send the termination to the consortium for a small group in a timely manner. Delaying these terminations causes a number of things, including inaccurate billing, claims paid for members who should not have had active coverage, loss of money for the municipality, as we can only backdate up to 120 days for premium reimbursements, and coordination of benefits issues.
So I
Any
got a,
questions on
yeah, I
that?
just got a question. So going back to that one about the date of termination, because sometimes when you go in, when it's been more than a couple of months, it's hard to go back. It doesn't let you go back online to June 30th if you're talking about in October. So do we need to contact you direct to say, hey, we need to take it back?
Are you gonna do the training? Because like I'm,
So, if as a large group you have the access to submit a ticket to request it being backdated to that June 30th date, and you can attach the enrollment form, or you can reach out to us, for us to submit the ticket.
Okay, thanks.
Yep. Anything else? Okay. Next, we are going to move on to 65 plus active employees. So, case number 4, Shane turned 65 and works for the village and wants to remain working. He received a letter in the mail from Excelis asking for his Medicare information. Does he need to sign up for Medicare? He works for a small employer. So, this isn't a poll, just something to think about. Do you have any employees that fall into this situation? Okay. As a consortium member, you're considered a large group employer, so you might have a question of what does this mean? Active employees over age 65 can choose to defer Medicare Part B or choose not to sign up for Part A or Part B. Part A covers hospital and hospice, while Part B covers outpatient services such as doctors and will only pay if it covers more than the current health insurance. Medicare Part B does have a monthly premium rate that applies. If the employee is not collecting their Social Security, they'll not be automatically enrolled in Part A and will need to do so on their own, which they can do through SSA.gov for Part A or Part A and Part B. And then when it comes time, the employee and employer will need to complete the form from Excelis once the employee has received their Medicare card. And it's okay if this process takes a few months because the consortium is still the primary payer as they are an active employee. Any questions on all of that information? Okay, we are going to move on to COBRA next. Case study number 5 and our final Zoom poll question. John reached out to the consortium wondering when he can enroll in COBRA since he recently lost his job at the town and he doesn't want a gap in coverage. Who will send John the COBRA election notice? The options are the town, the consortium, Excelis, Lifetime Benefit Solutions. We will wait for answers to come in.
I know you can't see them, but they're still putting them in there. So give them another 30 seconds. We nearly have a tie. All right, I'm going to end the poll and share the results.
So the winner was the consortium. However, that is not correct. While we process the termination, through Excelis, that triggers Excelis to send information to Lifetime Benefit Solutions. So large group municipalities process their own COBRA administration. Small group municipalities are processed through the consortium and LBS. An important note about COBRA election notices, they must be issued within 44 days of the termination of employment. And dental and vision COBRA election notices are not handled by us here at the consortium, but they are required notices to be provided upon termination of employment. Any questions on the COBRA? So you might have a question after that. Are you small group or are you large group? So we do have here on a couple of pages, because there are so many, who our small group municipal members are, and this information is available outside of the training that you'll get a copy of, so you can check if you're unaware.
I just want to chime in and say too, we understand you don't have COBRA enrollments that often. So if 2 years from now you need a refresher, you can always reach out to our benefits department and we can go over the process with you, and what those notices and enrollment process looks like.
Terminations are submitted via the consortium. COBRA notices and mailings are generated. If the ex-employee wants to enroll, the enrollment is processed through LBS submission to Excelis. LBS then bills the ex-employee directly 102% premium rate, so it's 100% of the premium plus a 2% administration fee. LBS sends payments back to the municipality, and then the consortium billing continues with 102% premium rate for COBRA enrollments to the municipality. And I know there are a lot of steps there, so does anyone have any questions? Okay. Next, we are going to move to wellness, which has been very exciting this year already, just in the first few months. So we have a consortium wellness email, which I'm sure most of you received those. One just went out this morning. So the first of each month, we send out an email that's packed with updates on upcoming activities, challenges, webinars. We do encourage you to share these with your employees to help promote wellness and increase participation in our programs. We had a whole flood come through after this morning, so we like to see that. If you're forwarding the emails that you receive, the forward option in your email service breaks the link. So if you scroll all the way to the bottom of each one that you get, there is a share button, and you can put the employee or the recipient's email address in there. If that might be a little too much for you to handle, we can also do that where we just get their employee names and email addresses from you, and we can add them directly so they receive the wellness straight from us. Okay. Next is our upcoming wellness events. So as I mentioned, we've had a whole lot going on the first few months of the year already. We do have a week from today, the Advanced Care Planning webinar. That is April 8th at 12:30 via Zoom. Next month in May, we have Cultivating Healthy Spaces to promote May as Mental Health Awareness Month. We also have a tick prevention webinar May 14th at noon via Zoom. We have a behavioral health webinar, an attitude of gratitude, May 27th at 12:30 on Zoom. In June, we are hosting a toiletry drive. Many of you should have received an email from us this morning looking for host locations. So we definitely want to get those. June 9th at 12:30, excuse me, we are having an MD Live webinar on Zoom. July is a digital detox challenge and yoga for neck and shoulder strain, July 8th at 12:30. And then all year, something new that we designed is our monthly meditations. Anyone can join that at any time, and we'll send them the most recent meditation. If you are interested in signing up for any of these, email your name and municipality to hcwellness@tompkins-co.org. And if you're looking to register for Cultivating Healthy Spaces, be sure to include your work address, and that registration is due by April 21st. And there is a question, should we?
Yeah, should we be able to see the details of the wellness classes from the email? Because I can't. Are there details also on the consortium website? So when the emails go out, your firewall may block the images. So if you right click on them and click download images, you'll see all the flyers for the upcoming events, which really do have the details of the when, where, how, and all of those. Mainly what you can see when you get the initial email might be just the registration buttons. And then the details are up on our website. We have a whole wellness page. If you go to www.healthconsortium.net, right on the landing page is these four buttons. If you click wellness, that takes you to our wellness landing page where you can see all the flyers for the upcoming events and information about how to register.
And we do also post the information on our Facebook and Instagram too. So if you haven't followed us, that is a great place to check out too. Thank you for putting our website in there, Kylie.
I'm trying to multitask here.
I appreciate it.
Staying on
So
top.
as I mentioned, we have the upcoming toiletry drive. So SNAP, Supplemental Nutrition Assistance Program, is great at providing those who need it with food and items like that, but they do not provide toiletries. So that's what we're focusing on this June, and we would love to find some of our benefit clerks or municipalities to serve as donation locations where items can be dropped off. If you want to be a drop-off location, you can email the hcwellness at tompkins-co.org by May 11th, just so we can make sure to get it out there and mark it. You will be responsible for collecting the donated items and delivering them to local pantries, so just keep that in mind. And then there is a list of items for donation, so things such as like toothbrushes, toothpaste, body wash, sunscreen, baby wipes, diapers, sunscreen, those things are all not covered by SNAP. And just an important note, any items that are collected and donated should be new and unopened and unexpired. Okay, thank you. And next, we will have Elin Dowd, our executive director, to discuss our consortium updates.
Thanks, Kylie and Jess. I was off screen trying to catch up on things because I've been on vacation, and I was stuck in email jail all day yesterday. And I thought I had to about 11 o'clock. You guys are really flying through this information. So I'm happy to join everyone today. Good morning. I want to start off script because I'm getting this question daily and just want to let you know that it's really too early in the year for us to advise you what to put in your budget for premium increases for 2027. I will let you know that when we put our budget together for 26, we did an 18% increase, as you know, for 26 and a 15% increase for 27. And then it kind of drops off after that. It's too early in the year for us to know what kind of experience we are having so far. You know, we're under at budget. And that's due to everybody reaching their deductibles at the beginning of the year. So it always looks great at the end of the first quarter, and then we kind of see where those large claims are going to settle in. So we'll know more come June, but I think if you budget, 15% and put a little cushion on that, that's kind of what we planned for. Other than that, I don't have really good information right now on budgeting. The other thing we are working on that I know keeps coming up in questions, we are going to start making presentations to committees on recommendations on 2-tier, 3-tier, and 4-tier premium programs. I don't know what's going to come of that. It's coming out of the committee process, and it will be advanced up through executive committee and onto the board later in the year. But Kylie and Jen are working on that with Kylie heading up those efforts, and we'll start seeing some feedback coming through the committee process, the operations committee first. So those are two popular questions that I wanted to make sure we addressed before I jumped into these next slides. So we can move to the next slide, I think. All right. Kylie's asked me to share a little bit about our plan management policy. This had a different name that none of us could ever remember. So we've started calling it PPOPP, which did not sound good. And it was recommended we just shorten it to the plan management policy. This has not been finalized 100%, but I just want to give you a heads up of what is being recommended for change within the plan management policy. This policy was put together sort of like an administrative guide. Number one, it says who can be covered under our plans, how are they covered, and what you can do with your plans once you have those people covered. So it talks about who can be offered health insurance, and it came up on a previous slide today. You determine if your part-times are covered. You determine if your elected officials are treated as employees. You determine if they get coverage the first day of the month or they have to wait 9 months. That's all determined by you, but it has to be an employee or a retiree that is a subscriber. And so we needed to articulate that within our policies, that it is an employee, it's an active employee, it's a COBRA employee, a non-Medicare aged retiree, a Medicare aged retiree, or a Medicare aged retiree spouse. That's the only time spouses can be separated, can all be covered under our policies. So domestic partners, you also decide if you want to cover them, but if you do, they're covered under our policy. So there's a lot of information about that kind of administrative guideline for you. We also go through the how and when can they sign up. We covered COBRA today. That's when they go off, but qualifying events that allows them to join the plan under your coverage or add someone to their coverage. The other thing is, what can you do? So municipal members can change plans, and we have bumped the date up for when you need to notify the consortium if you're making a plan change. Initially, we used to just say October 15th, let us know. And what we found out this year, that October 15th is too late in the game for the consortium to adjust their budget if people are making, or a group is making a huge change. So if you're coming off a classic blue plan and going to a bronze plan, that's a huge change that if we find out October 15th, it really affects the budget, and that budget has already been approved. So we're asking now that municipalities give me a call, set up an appointment so we can talk about what you're thinking about by July 1st. So let us know as we're building the budget. If you're thinking of a huge change, give me a call. We can discuss it. We'll bring in the experts if you want to compare plans or look at financial calculations. We'll pull Kylie and Jen into the mix. So we know as we're preparing the budget, what that looks like to the budget. You don't have to finalize your decision July 1st. It's just a conversation. But we do need formal notice by September 1st. That's for a January start. If there's any other changes, we don't like mid-year changes, but it has to be a 90-day notice for a mid-year change. And then once you make a change, We ask you to maintain enrollment in that plan for 3 years. And then we'll talk about the next thing in a minute. So why are we doing this? Why come up with all these plans? Seems like restrictions. Why put this policy in place? It's due to adverse selection. So you ask, what is adverse selection? We talk about it a lot. We throw that out. Adverse selection occurs with individuals with higher risk or more likely to purchase insurance. That leads to higher costs and instability. So we are one risk pool, all of us, healthy, unhealthy, young, old, Medicare eligible, non-Medicare eligible. We're all thrown into this one risk pool. And what happens to this risk pool to one person kind of happens to us all because we're all in it together. That's why we came together, to be supportive of one another. So 1 year, one municipality may pay more in premiums than they're getting out of the plan, but the next year they may have a really high claim and other people are supporting them through their premiums. So we come in and we share the risk together. When we have sick individuals on the most expensive plans and all the healthy people on the cheapest plans, that's adverse selection. So we're making sure that we don't have an imbalance within our pool. We're also trying to make sure that a healthy person isn't in our least expensive plan while they're healthy. And then they have the opportunity, oh, I just got a huge diagnosis. I'm going to be on this really expensive infusion drug. I don't want to be paying a deductible for that. I'm going to jump over immediately and join the platinum plan where everything's covered. So we're trying to put restrictions on who can jump, when you can jump. So if you jump, there's a 3-year provision that you, the municipality, stay in the plan you are moving to for 3 years, and your subscribers, if they have an option to move, they're within what they can move for 3 years. So people aren't jumping around when they're healthy and sick. So that's why we put these parameters in place. It's really to eliminate this adverse selection. The other thing that hurts the risk pool is when a group moves from a higher cost plan to a lower cost plan, there is still run out of claims, usually for about 3 months. And if it's a significant move, the consortium is left to pay the run out of those claims. Because we're kind of built on an ongoing basis. Yes, you pay premiums for 12 months. Yes, those claims happen within a 12-month period, but it's not as easy as that. So we kind of look at the whole picture. Every year we know there's going to be run out. We look at the premium for the next year. But if someone jumps plans, that really upsets the apple cart a little bit because we all assumed we were kind of in the same place. So we are looking at a little surcharge if you make large tier movements. So if you go from platinum down to silver, there might be a surcharge. And if you go from platinum to bronze, there's a little surcharge. So we're looking at a combination of what the premiums would be, maybe a little bit higher within that first year. You'll still receive savings if you move, and some significant savings if you move, but you might pay a little surcharge that first year. And we're working on that calculation now. It will go to the operations committee tomorrow and then on to the executive committee the beginning, the end of this month. The other thing we're looking at is small plans versus large plans. That if you're under 50 subscribers, so a small municipality, there's one plan for everybody under any municipality under 50 subscribers. Larger municipalities can select two plans. We're also trying to eliminate some plans. We're trying to consolidate. Not that many people are on our Classic Blue or our PPO plans, but we still do have municipalities that are moving those plans. More plans means more administration. More administration means more costs to municipal members. And one of the things we say about the consortium versus, for example, at Excelis is we have less administration because we're more efficient. And one of the reasons we're more efficient is we limit the amount of plans we offer. So we are approaching people who are still on Classic Blue and PPO plans to say, could you consolidate into one of these 6 plans that we still have remaining? Ultimately, it'd be great if everybody was on middle level plans. Or a Medicare supplement plan for retirees that would help us consolidate administration. But we are articulating within this policy, what plans are available. Classic Blue and PPO are not available to new members. Although if a huge new member came to us and said, PPO is the only way for us, we might consider it. But we are not offering that to small groups that are joining us, just so we can keep our administration down. We already talked about plan selection for 2 plan options for active employees and non-Medicare age retirees. So you can have 2 plans plus a Medicare supplement plan. The one big thing that we are articulating, because this didn't seem to be clear, there are municipalities that offer 2 different Medicare options. They offer a Medicare supplement plan through the consortium, or they offer outside the consortium a Medicare Advantage plan. And that can be with numerous organizations. A bunch of you have it through Spanny. If you are offering 2 plans, or even if you aren't offering 2 plans, if someone leaves consortium coverage to go to a Medicare Advantage plan, even though that's an employer choice, they can't come back into the consortium. I could have put a poll up here saying, why do you think we don't want them back? Because usually if they're coming back, it's because they've been diagnosed with something. They want to jump back on the security of the consortium plan and have us pay the whole risk of that, where we've lost all those premiums when they were outside on another plan. So we're saying if your retiree elects an outside option, they're gone. Hasta la vista, they don't come back on the consortium plan. That keeps the rest of the pot safe. I heard a ding. Are there questions? Or are you going to interrupt me, Jess?
I will interrupt you. I haven't seen anything come through on my end.
Great, thanks. Okay, and then I think the last thing on this, there are waivers. If you have a union contract in place and you say, we just can't get these guys to agree to come into this other plan. We're all on the platinum plan, but they want the silver hybrid. If you have to keep them, we will consider a waiver. The waiver will go to the executive committee for immediate review. So as you're negotiating the consortium feedback on a waiver. There are a few waivers in place. We are not crazy about waivers. We're going to be becoming more restrictive on waivers because we want more people in the risk pool. We don't want people saying, I want to pull this out or I want to do something differently. But we will consider it. And there's going to be a few things spelled out when we will consider waivers, union contract being one of them. The other waiver, common waiver, is a Medicare Advantage plan for your retirees outside the consortium. We currently have a resolution in place that allows for that. I'll pause for a second to see if you have any additional. Oh, can we just go back one slide or two slides? One slide. Two slides. Shout out to our website. Right now, the policy is located. I think Kylie's sending out these slides, and you can click on the link. So you can look at the policy now. And does this have the suggested revisions on it, Kylie?
Not yet. This is the last approved policy, and then the updates are presented to operations tomorrow, and then executive committee on the 15th of this month.
So if anyone wants to look at this in more detail, we'd be happy to send out a copy of this comprehensive policy to you with our red lines in it. But we're hoping that this gets approved at the executive session. So two more slides. Because I'm talking about it on April 23rd. So if it's not approved, we're not quite sure what we're presenting on April 23rd. But we want to, if it's going to be changes for your municipality, or what you're thinking, changes you're thinking about making for 2027, we want to make sure you have this information well in advance. So if your municipality is thinking about a plan change, doing something different with your retirees, April 23rd at 3 o'clock is the educational session for that. You may want to ask your decision makers to attend that educational session. And while we're here, let me promote the other sessions. I don't know how many of you have been attending these sessions, but we were asked to provide more educational materials to our members throughout the year. So when it comes for you putting your budget together, thinking about plan changes, thinking about anything having to do with health insurance coverage, we try to include them all. So we've already had 2 educational sessions. They are now recorded. I don't know if the second one's out there yet. And they're going to be posted on our website. I think today the email is going out for the March educational session. And in May, I highly recommend May Medicare 101. Our Medicare expert, Kylie Rodriguez, will be talking about Medicare. And if you haven't gone through the process yourself, or you haven't gone through the process with employees yet, this is a really good webinar to put all the pieces together, how to coach your employees, but also as an employer, the decisions you are making to assist your retirees that are to help them make the right health insurance decisions when they are Medicare eligible, because giving them misinformation may cause them to pay more in premiums when they are Medicare eligible. We're also going to have a CanRx overview from CanRx. So we hope it's going to be an educational piece on saving through that program. And then our last webinar will be ESI talking about employee assistance program support and why you might want to think about adding an employee assistance program to your group of benefits. Now, we show stopping in July, but August 18th, I believe, is when we have our board education. Any changes that are going to happen to our plan, the policies, the budget, the premiums, any plan changes, we educate everybody in August. So by the time our consortium votes in September, this information has been shared so it can resonate with the municipality. You can make the decisions you need to make by September 1st, and the board can vote on September 24th. So if you haven't attended educational sessions and you want more information, they're going to be all posted on the website. And if you haven't, but you want to, please put these dates down. You can contact Lynn to sign up for those educational sessions. And for those of you that have come, thank you very much for joining us. We do want to get more participation. So if you've enjoyed them, please spread the word. Any questions on educational sessions? That's my big sales pitch for the day. I also think it's my last slide, right, Kylie?
It is.
Great. Thanks, everyone. Thanks for joining us today. Appreciate it.
All right. I just had a few kind of housekeeping items just to put on everyone's radar. Um, So we are always playing catch up when it comes to updating our contact list with our municipal members. We understand there's, new elections, new employees, changeover of responsibilities. And it's important to let us know so we know who to reach out to, who to send an invoice to, who to invite to this training. So we do actually have like a contact form on our website, and I did hyperlink it here. So when you get the slide deck, you can click on this to enter any updates. The form comes to me and Lynn because we kind of manage our contacts. The whole staff eventually needs to know who to reach out to where, but just making sure that we have the most current contact information. There was a recent New York State mandate about municipalities with a population of 1,500 or more need to update their website, which some of our municipalities who updated to a .gov domain also updated their email addresses. So some of our emails aren't getting through because the email addresses have updated and we weren't aware. So anything like that, we more than welcome you reaching out and making sure that we have the correct contact information and submitting that to us. And believe it or not, we are required to keep that information and it has to be up to date. We have to submit it, not your email address, but names like town supervisor, town clerk. We have to submit that with our annual jurat reports. And if it's not accurate, we, get a little flag that we need to update our contacts. So any help you can provide in that avenue is greatly appreciated. Now, everyone, I don't want you to freak out, but we do have another dependent audit coming up in 2027, so way far away. But I want it on your radar because we'll be conducting the audit in 2027. Last dependent audit we did took over a year to complete because certain union groups required MOUs in place to complete the audit. There is communication out to your employees and paperwork they may need to send back to you to confirm, yes, we're still married, or no, I forgot to remove my ex-spouse from 2 years ago. what's the next steps to get that processed. There'll be more instructions as 2027 comes closer, but I just wanted to give you a heads up way in advance so you can start planning for that. And we'll probably roll that out in January, between January and March of 2027, to start that process and allow enough time for each one of our municipalities to kind of go through their records and make sure they have what they need on file for each subscriber and their dependents, and then do a double check and make sure everything's current and up to date with their subscribers. Um, Different examples that we've come across, maybe they're still providing health insurance for stepchildren, but they're no longer married to the spouse. They can't do that unless they are a legal guardian or, have custody, that type of thing. So just making sure that all those ducks are in a row because we want to be paying claims on people who should be members, right? We don't want to be paying claims on people who are just left on the coverage and should have come off a while ago. We're trying to be good stewards of the money that you're paying in premiums and we're spending back out in claims. We want to make sure that we're on top of that for you and your assistance will be appreciated in 2027. Questions. We covered quite the roller coaster ride of information from coordination of benefits to new policies to wellness, back over to dependent audits. So this is your opportunity. If you came with any questions that don't even pertain to the topics we talked about, we're more than willing to answer any benefit questions as they relate to what you're getting exposed to at your municipality. So feel free to unmute or write in the chat if you have questions that you'd like us to answer, or issues that you're seeing coming up. We're more than happy to dive into them too.
Kylie, one thing I'd like you or Jess to cover is kind of the confusion when there is a new baby of a family. I know we just had a situation where it was assumed because of some practices that the new baby was covered because an ID card came, but that's confusing. So would you just articulate that in case anybody else might be having a new baby coming on to the health insurance?
Sure. So there is a new federal law. It's the Newborn Act, which says when a baby is born, they're automatically put on the parent's coverage. So for a natural birth, they're put on for 2 days. For a C-section birth, they're put on for 3 days. They have to be a healthy newborn. If they're, needing NICU care, that's a different circumstance. But healthy newborn baby is automatically put on coverage for a limited amount of time. Where the confusion comes in is you're then set an ID card for this newborn. The assumption is they're now enrolled in the health insurance. I don't need to do anything. But that is only for temporary coverage. So any employee that's out on maternity or paternity leave, they still need to add the newborn to their coverage to make sure that they have coverage for the next several months, years, however long they're going to be on the plan. We recently had a case where a member thought they had the newborn enrolled and they'd gone five months without coverage and had no idea because they had the ID card and Excella suppresses any termination notices for that temporary coverage because it's only supposed to be a few days. You get the kid enrolled on your work insurance, you're all set. But that was not the case for this one. So just to make you aware that if an employee comes to you and says, oh, it looks like they've already enrolled, I got an ID card, and you as a benefit clerk have not processed that enrollment, that means they are not enrolled. Because normally by the time they're reaching out to you on maternity or paternity leave, it's been a few weeks since the birth. That does not mean the baby still has coverage. So one of the best practices that was mentioned here before by a benefit clerk is before they go out on leave, have them complete an enrollment form with all of the information or as much information as they can give you. And then all they have to do is call in with the date of birth, the name of the child, and it can be processed without them having to come into the office. I think that's a great practice. It makes it more efficient for you, and it also makes it easier on the new parents who are severely sleep deprived, as was my case. But just something to keep in mind that that is a new law that's been into effect over a year now. Um, just a small side note. If you're covering, let's say you're covering
May I interrupt just
your,
for a minute on
yeah,
what
go
you
ahead,
just said?
Denise.
So we had a situation where we had one of our employees, she had a child, and it was, I guess this law was in effect, and so she got on my case because she wondered why she was being charged because the child was going to go on their father's insurance. So that was a big mix up there. So now that we know, I can just let her know that, or we can just let her know that, and we had to go through and make sure that any bills that were paid under the city um, through Excellus, that it was reverted back to her spouse.
Hmm.
So I don't know how we handle things like that, but that's just one thing that happened with us.
Yeah, it's definitely not perfect, and we still have to be in compliance, even though in like that case, it would have been better if they had auto enrolled into the father's plan. But um, yeah, it's definitely a stumbling block. One of the other ones that came up last year was if the subscriber is covering their daughter who's maybe 24, let's say, and that daughter has a child, so now that's a grandchild, it will get those 2 to 3 day coverage, even though that grandchild is not a dependent of the subscriber directly. Um, it's weird because I've always told you, grandchildren are not covered under plans as dependents unless the subscriber has custody or has that legal guardianship. But with this new mandate, it still allows for that 2 to 3 day coverage, even though they are a grandchild of the subscriber. So, just some weird things you may notice. Um, but good question, Elin.
There is another one in the chat. If a person wants to change to the Medicare supplement plan outside of open enrollment, can they?
So this question came up, and I got direct information from Excellus on it. So technically, yes, they can because the Medicare supplement plan is an employer plan being offered to the retirees. Under standard Medicare rules, no, they'd have to wait for a special enrollment period or open enrollment to make those changes. But in our case, for our Medicare supplement plans, yes. So maybe they ran out of sick bank time and they want to move over. Those types of things, they could enroll in the Med Sup. Was there other questions in the chat?
There is not.
Okay. Any other questions from anybody else? Going once, going twice. All right. I appreciate your time. I know Jess appreciates your time, and so does Elin today. Um, this has been great meeting with you and you taking the time out of your day to meet with us and learn some things about our plans and how we've been working and what policies are coming up. We encourage you to share that wellness email that came out today. And if you have any future questions, our contact information is listed on the screen. Feel free to reach out directly to any one of us with any questions you may have. Thank you so much.
Thank you.